Welcome, everyone, and thank you for joining Amethyst at Penn's April seminar. We are proud to offer this content through our Amethyst at Penn Hub, which stands for Achieving Maternal Equity and Transforming Health Through Implementation Science and Training. Funding for this hub comes from the NIH's Improve initiative, which aims to reduce maternal mortality and improve pregnancy, perinatal and postpartum care. Hi, everyone. My name is Emily Fender. I'm a postdoctoral research fellow for Amethyst at the University of Pennsylvania, and I have a background in health communication. I received my PhD from the University of Delaware in May of 2024, specifically focusing on health communication and reproductive health and women's health. And so some of the work that I do focuses on examining messaging about women's health on social media, and then experimentally test those messages to understand how social media messaging about health impacts behavior. And so some of the information coming from today's seminar will be based in that area of research. And specifically, what I'm sharing today is practical steps for using social media to improve maternal health outcomes. So just an overview today and an agenda for today. I'm going to overview the communication model, a fundamental model we use in the communication and social science space. And then I'm going to overview how to create effective messages about maternal health on social media using the components of that model. This seminar is part of a multi-phase seminar. We had one in March focusing on um, maternal health messaging on social media and how it impacts behavior and what those messages actually look like. So I did that in March. Now in April, we're focusing more on essentially translating evidence that's very complex into digestible formats. And if we were to share this information on social media, what would that look like? And that's kind of the focus of today's seminar. And so we recognize social media as a tool to disseminate evidence-based information. And this is part of Amethyst's policy core mission, where we're focusing on disseminating information to the public. The other thing that I'd like to focus on today is that we shouldn't take posting information on social media lightly. There really is a formula for researchers. They should have a content strategy, and hopefully some of the tips in the seminar will help you understand how you can disseminate your information so that you can get high engagement rates, so that you can reach as many people as possible. So just to go over the communication model, we have five components here, including the source, the message, the channel, noise, and feedback. These can be used to guide social media content strategy for researchers. And so first, we're going to dive into the definition of all five components, and then we'll explore practical tips for social media strategy guided by each of the five components. So the first part is the message. This is just what is being communicated, what we exchange during an interaction. And what we know is that there's two levels to any message, the content and the relational level. So the content is just the actual words. So someone says, I love you. We know that they are interested in us. That's the language used at the content level. The relational level, this is the underlying meaning of the message. So if we think of the content level being I love you, the relational level really is something deeper. It's indication of investment in a relationship. It could mean that we're family or we're in a romantic relationship. It could mean I want to keep you in my life. I care about you. It has all these different um, kind of other meanings at play. Messages can be verbal or nonverbal. So, verbal is anything that uses language. This could be you speaking directly on social media. It could be commenting and typing something in text that's still using language. And then we have nonverbal, anything that's expressed without language. So, maybe an emoji on social media or a like could be a nonverbal behavior. We also have the source. This is who is sending the message. This involves the sender and the receiver. In this case, it would be, the source would be researchers posting information about maternal health on social media. The idea that being one or the other, being only sender or only receiver, is really an antiquated oversimplification of the communication process. This kind of refers back to the hypodermic needle theory, which suggests that media messages are just directly injected into the audience's mind, often assuming a really passive audience that just absorbs information without questioning or responding. And what we know today is that everyone is both sender and receiver. So you might think that you're just receiver right now, but if you were to be on camera, you would be, or even off camera during this seminar, you would be sending messages to me about your feelings and feedback to the seminar itself. Maybe you're asking questions, maybe it's just how you're dressed. You show up for a meeting, you don't show up for a meeting. All of these things involve us sending messages. We also have the channel. This is how the message is sent. Channels might include social media, they might include texting, face-to-face communication, Zoom, and these all have implications for how messages are sent and interpreted, some with more nonverbal cues than others, and some with different features. Then we have feedback. So the communication process is affected by what the other person does. So there really is this back and forth. And in the context of social media, what we're really thinking about is how we adjust or react to the messages we receive from our audience. And that's our feedback. And then finally, we have noise. This is stuff that interferes with or gets in the way of communication. So we have three types of noise that could happen. Physical noise would be things that physically get in the way of communication. Maybe I'm playing music during this entire presentation. That would be distracting for you. Maybe a fire truck goes by and you can't hear me. That's physical noise. We also have psychological noise, things that you're thinking about that make it hard to focus. Maybe during the seminar, you're thinking about what you're having for lunch or what time you have to pick up your kids or what you have left to do the rest of the day. And so those are things that are mental distractions and psychological noise. And then the one most salient to social media is semantic noise. This is when people genuinely don't understand the communication. So it's really the case of, I hear you and I'm not distracted, but I don't understand. This is something we have to be very aware of as researchers in the social media landscape. This often surfaces when researchers or physicians online use medical jargon to try to explain complex ideas that most viewers do not understand. So I'm going to apply the communication model now to developing social media messages for researchers and for physicians. So let's circle back to the message. How do you frame your message? What content is included? So to frame messages for clarity and engagement, the first thing we want to think about is the hook. And hooks can be visual and verbal. With this in mind, you should aim to capture your audience's attention in 3 to 5 seconds. We do not have long attention spans anymore, and so we need to be immediately engaging people with our content. So an example of this would be for a visual hook would to provide movement. So some content creators, researchers, whatever, whoever they may be on social media, will do a dance. Some will start closer to the camera and move back. That type of movement draws people in. And so there are a couple different ways we can do that. Verbal hooks are typically text overlay at the top of the top of the post, which is basically just a couple of words explaining what the entire post is about. This is really important because it immediately tells viewers if this is a topic that they would be interested in. And so the way that you describe that is very important. We also have brevity. Posts should be short and actionable. Captions should not be more than 1 to 2 sentences, and reels, which are just videos, should be under 30 seconds. 20 to 30 seconds is kind of the sweet spot for this. Next, we have tone. The tone should be relatable, encouraging, approachable, and not prescriptive. So, we talked in the last seminar about how a lot of physicians online and researchers tend to be prescriptive. So, they use language like, you should be doing this, you should be aware of this, you should think this way. And that tends to turn audiences off. And what we know from at least my body of research is that those types of posts, when they use prescriptive language, tend to get significantly less engagement, less likes, comments, saves, shares. And so it's not reaching as many people. And so the tone should be relatable and approachable. So instead of doing a post that says 6 symptoms of preeclampsia that you should know, it would be better to just say 6 symptoms of preeclampsia. Next, we have language. We want to avoid medical jargon. An example of this, I've seen a lot of physicians describing their background or what they do, and they'll use words, especially in a maternal health context, like gestational hypertension. It would be better to just say high blood pressure during pregnancy because the average person may not know what that means. I've seen posts where physicians are describing their background and they'll use terms like trophoblast, which is just not something that the average consumer would know. And so we want to avoid medical jargon and really oversimplify as much as possible. We also want to use high contrast text and captions for our visuals. So the best way to do this is really just to have a white background and black text. Often we see people putting like colorful text against a white background and it blends in and it's very hard to see. And so for visual accessibility, we should be using high contrast text and captions. And then finally, we should have a call to action. A call to action, it just encourages further engagement. So I've seen some posts that say tag a Prego pal or share with a Prego pal to encourage further discussion and sharing that content. And what we know is that the more that people share that content, the more people see it, the better reach we have, the more people we are engaging with. The next thing I want to talk about is humanizing the topics. Researchers and physicians often don't share real stories from people who are experiencing challenges in their pregnancy journey, whether that be postpartum, during certain phases of their journey. And so sharing real stories is really important. And we know this because provider content is often viewed, according to the research, as less relatable. And thus, because of that, we see less dissemination. And again, this happens when physicians or researchers use very prescriptive language and try to kind of treat their posts or their communication as more of a medical consultation or a video meant to educate. And people respond better to stories. And so, those are the types of things that we want to be including in our messages. Other types of messages that physicians, researchers can share would be myth-busting facts. This is something that is often used in this landscape. What we know is that pregnancy-related health misinformation can be countered, and there's a lot of health misinformation on social media. But myth busting can sometimes be negative because it can reinforce misinformation. So even when misinformation is corrected, many people still believe the initial misinformation message. We need to think about other strategies for approaching this. So in some cases, pre-bunking has been shown to be effective. Pre-bunking is a proactive strategy used to combat misinformation by exposing people to a weakened version of false claims before they encounter them in the real world. So the goal is to kind of build psychological resistance, making individuals less likely to be misled when they do come across the actual misinformation. This doesn't work for newer topics. So this wouldn't work for misinformation about vaccines because most of those messages have been widely disseminated, but it might work for newer forms of misinformation. For example, a newer claim about hormonal contraception is that it changes your personality and makes you dislike your partner, and thus it's part of the it's a reason for the high divorce rate. That's new information, misinformation that we're seeing, and so pre-bunking could be effective in that type of context. And so, where should you be disseminating your evidence-based information? A couple of different platforms we could talk about, Instagram, TikTok, Facebook, and YouTube, just to name a few. Choosing the right platform really is critical to ensuring that your maternal health messages reach the intended audience effectively. And different platforms attract unique demographics and support different types of interactions, making them better suited for specific goals. So let's talk about Instagram. Instagram is best for visual storytelling, building community, and sharing detailed resources. Instagram attracts a slightly older audience, so more of the 18 to 44 range, which aligns well with many maternal health demographics. Features like stories, which are only posted for 24 hours, carousels, which are swipe through posts, and reels, which are videos, allow for a mix of brief updates and in-depth resources. And so an example of this might be highlighting personal stories of mothers, offering prenatal tips through swipe through guides, or sharing quick myth-busting reels on maternal health disparities. There are a couple of people tagged on the slide who do a really nice job of creating content like that on Instagram. We also have TikTok. This is best for quick attention-grabbing content that can go viral. We have a younger audience here, 16 to 34. So this is ideal for reaching younger moms or those likely to engage with traditional healthcare messaging, or less likely. And its algorithm amplifies very authentic, relatable, and entertaining content. So we would want more trendy, entertaining, story-based content on this platform. And so an example might be a 30-second video addressing a common risk factors for preeclampsia with trending audio or someone doing some type of dance to kind of relate to the trend. We also have Facebook. This is best for community building and discussions, especially for older audiences, 35 plus. The groups provide a space for peer-to-peer support, making an excellent platform for ongoing conversations about maternal health and local resources. When I was working at the NIH, we were studying Facebook groups used by parents of children with rare diseases, and Facebook as a platform was really great for that audience because it's a rare disease. So there aren't many people who could relate to or have had experience dealing with these health conditions. And they were sharing resources such as physicians in the US that would be able to treat or at least help manage the condition that their child was experiencing, which you could imagine there would be not a lot of information out there about rare diseases. And so this was very effective for that. And then finally, YouTube. Amethyst at Penn has a YouTube channel. Just wanted to mention that. We do long form educational content. We post our seminars there. This is really good for expert-driven discussions. YouTube does have a very broad audience, so the content format allows for deeper dives into topics, maybe like labor preparation or maternal mental health. An example of this might be a series of 10-minute videos featuring maternal health researchers explaining complex topics in simple terms. Let's move on to feedback. So measuring impact and refining strategy. So the goal of social media is to disseminate research findings, rather than storing them solely in a journal that might not be as accessible to the general public. And so examining feedback and engagement metrics is really critical to understanding our dissemination efforts and can help us refine our work to ensure that we're reaching as many people as possible. So we have quantitative metrics. Views are the total number of people who actually see your content. High reach indicates strong visibility. We're reaching a lot of people if we have high views. We also have engagement rates. We can track likes, comments, share saves, and click-through rates to measure how well the content is resonating with our audience, not just how many people are seeing it. And then we have video metrics, so we can monitor video views, completion rates, and replays on platforms like TikTok and Instagram Reels. Use when we're thinking about content that gets high views or engagement, this could be a model for future posts as well. This is the type of content we want to keep making because it's an indication of what format is effective with audiences. And then we have qualitative metrics. We can examine comments. We could do content analysis, studies, examining the sentiment and the themes in user comments to understand how audiences are perceiving our messages. We could examine direct messages, so review questions or feedback that we receive via direct message for recurring themes or concerns, which could give us potential ideas for future content. And then community interaction, so evaluating participation in Q&As, polls, or discussions for deeper insights into engagement. So an example of thinking about feedback is, let's say, a TikTok video on preeclampsia prevention garners significant views, but very few comments or shares. It may indicate that the content is informative, but it's not engaging enough to spark conversation. And so this is the type of feedback we would want to consider when creating new information and new posts so that we can reach more people. Something else to consider here is to know your social media institutional policy. Um, every university is different. I have a snapshot here from Penn on their policy. It really just is that employees are personally responsible for the content they publish on social media sites. They should be careful about what they're posting, especially when talking about patients or other employees. And that they're subject to the same professionalism and behavioral standards as any other personal interactions. So keeping that in mind and thinking about how you respond to other people who comment on your posts, because maternal and women's health is quite politicized on social media, and so you will receive hate comments for posting this type of content. We got a question about are physicians on social media perceived as less credible? I think it's an interesting conversation here about, even in the scientific community, sometimes there's a stigma against sharing research and information on social media. But if we want to reach more people, that is where the people are, and that's where they're absorbing information. And so I think that it's a valuable endeavor. This may be less viable for early stage investigators or those in the job market. That should be taken into consideration. And so there are just a couple of things about doing this type of work that we should be aware of. So in conclusion, for the message, we want to craft clear, empathetic, and actionable content tailored to our audience's needs. For the channel, we want to choose the platform that aligns with our audience demographics and content goals.